Hello, my name is Lori Brooks, and I am a certified registered nurse anesthetist at Spartanburg Regional Medical Center. I am going to tell you a little bit about my profession and why I got into it, but first off, let me tell you about my education. I went to Clemson for 4 years for nursing and became an RN. I then had to work in an ICU, which I worked at McLeod in Florence, South Carolina. And because at that time, and this was back in 1995, at that time, a lot of the hospitals wouldn't hire new grads into the ICU. Florence they were willing to take a chance on me. So I ended up working in the ICU in Florence at McLeod. I worked there for 1 year, and then I applied to anesthesia school at USC in Columbia. I knew that I wanted to become a nurse anesthetist because when I was at Clemson my freshman year, I had a mentor that told me all about nurse anesthesia. Originally, I thought I wanted to do administration, but then I realized that I wasn't too good at probably being diplomatic when it came to things that I probably felt strong about. So I ended up focusing my attention on anesthesia, and also when I went to clinicals for 4 years at Clemson, I knew that that wouldn't be in vain. Whereas with administration, I wouldn't use, my clinical skills in administration. So I decided to focus on nurse anesthesia. I ended up going to school for 2.5 years. And when I graduated in 1999, I came out with my master's degree. And that was pretty good because I didn't know that I was going to get my master's with that. But I knew that with my master's, I could still do the basic things, which were very important to me, being that I would have spent my 4 years at Clemson undergrad, and I didn't want that education to be in vain. As far as the skills that I do on a day-to-day basis, first thing when I come in the morning, this is my anesthesia machine here. So the first thing that I have to do is check it out. So it's like a computer. Every day we shut it down, turn it back on, and make sure everything is functioning before we bring a patient back to the OR, and you would want us to do this. At that point, I come over to the computer, which I don't think you can see, but I come over to the computer, I find my patient, get a health history so that when I go and introduce myself to the patient, I'll kind of have an idea of what kind of health issues they have. At that point, I go to the pharmacy, I get in any kind of narcotics that I may need for my procedure, and I come back to my room and I drop medications. Now I'm going to show you all the medications that I have in my arsenal. Okay, so I don't know if you can see here, but these are all the medications that I have that I may need in order to take care of my patients, okay? And don't worry, they will teach you all of this in school. So don't be afraid of, I may give the wrong thing. They're going to teach you everything that you need to know in school. Now, as far as the hardest thing that I've ever done at work is probably when I deal with traumas and they're dealing with kids and the kids may not make it. Those are probably the hardest days at work for me because I think about my own kids and I think about the poor mamas and the poor daddies that have to lose their child. So that's probably the hardest part about anything that I will ever do with my job. The best part of my job is I know that I'm helping people. I'm helping them to feel better. And I try to make them have a good experience when they come to the hospital, okay? As far as my long-term goals go, being that I've been in the profession for it'll be 21 years in June, my long-term goals is to keep getting better every day. Keep getting better at what I do. Keep making the patients feel comfortable. Keep caring about the patients. So those are my long-term goals. As far as the advice that I would give to you is when you choose your profession, make sure that it's something that you're passionate about. Don't do it just for the money. I lucked out and, discovered that nurse anesthetists, they make a lot of, make a lot of money. They have competitive salaries, but I did not know that going into the field. I did it because of the love for patients and I love the hospital. And some days when I come to work, it doesn't feel like work. So my advice to you is find something that you're passionate about so that when you go to work each day, some days are hard, granted, but for the most part, it doesn't feel like work. So don't just go after the money because money is not everything. There's no amount of money that can make you go into a job day after day that you don't want to be at. Okay, so always strive to do something that you're passionate about. Try to find your purpose for why you're here, and hopefully there's a career in that field. And good luck to you.